ever wondered what MRSA was? More than likely, someone you know may have MRSA on his or her skin. Methicillin-resistant Staphylococcus aureus, commonly known as MRSA, is a stronger form of staph infection that is harder to treat because over time it has evolved and become resistant to penicillin-related antibiotics. In 1961, a British scientist discovered MRSA, but the first known case in the United States was not until 1968 at the Boston City Hospital. In June 2016, my family and I were driving home from Moab, Utah, when we noticed that my 6-month son had a small pimple-like boil on his chest, and over the next couple days it started to get extremely red and swollen, and we decided it was time for us to stop 5 hours from home at an ER and have it looked at. The doctor there told us it was cellulitis and sent us on our way with some antibiotics. Over the next 4 months, he battled infection over and over again. Right when we thought it would be gone, it would reappear. By October, we had already taken him to our local hospital 2 times to try and clear it up. Each time, they'd hold him down in the bed and squeeze it to try and drain the pus out. And finally, the 3rd time around, I decided to take him to Children's Mercy, which is 100 miles north, at 9 o'clock at night, thinking it would kind of be like a release after a few hours, and nurses there were shocked at the size it was and had told us that we would be staying overnight. It was tested positive for MRSA, and we ended up staying about 4 nights total. After a couple nights, the doctor came in to tell us that they wanted to insert a drainage loop to help with to get the pus drained out, which the drainage loop is a minimally invasive technique in treatment of complex subcutaneous abscesses in children. The National Center of Biotechnology Information website says that this is their treatment of choice for treating such abscesses in children. When we were discharged from Children's Mercy, they gave us instructions to give bleach baths 3 times a week, give him his antibiotics, and they gave us cream for inside his nostrils. MRSA spreads like any other germ, by not washing your hands and by just touching contaminated objects. According to the CDC, 5% of patients inside all U.S. hospitals carry it inside their noses or on their skin. 1/3 of the total population carries it in general, but not all will experience such side effects. And here I have a small chart of comparing 100 people, and 33% carry it on them. MRSA starts as a small open wound leading to an infection that could resemble a pimple or a spider bite. The redness and hardness will grow, becoming warm to the touch, and could lead to a fever. WebMD suggests washing hands with warm water and soap, cleaning your scrapes immediately, and covering them with bandages to help prevent you getting MRSA. It says not to share personal products such as towels or razor blades, and shower daily. If you believe you have MRSA, please make an appointment to speak with your primary care doctor. If MRSA is left untreated, it could develop into sepsis. Sepsis.org states that sepsis is basically when your blood is poisoned due to infection, which can leave you disabled, organs not working properly, excess tiredness, amputations, or even death. In conclusion, about 1/3 of the population carries MRSA on their skin. Take good care of yourself by keeping good hygiene, and if you have any questions or concern regarding MRSA, you should contact your doctor. If it is caught early enough, everything will be just fine.